Good morning, teacher and students. My name is Jennifer Almeida, and I'm going to talk about tuberous sclerosis complex. First, we have definition. Tuberous sclerosis complex is a genetic disorder characterized by the growth of numerous non-cancerous tumors in many parts of the body. These tumors can occur in the brain, kidneys, heart, skin, and other organs, in some cases leading to significant health problems. Tuberous sclerosis complex also causes developmental problems, and the signs and symptoms of the condition vary from person to person.
Let me start first a little bit with the pathophysiology of TSC, and then it kind of relates to what you should be looking for as a clinician. So tuberous sclerosis complex is a genetic disorder, and it's caused by mutations either in the TSC1 or the TSC2 gene. And mutations in this gene lead to overactivation of what we call the mTOR signaling pathway. Now that pathway is important because more recently, or for some time now, we're starting to develop medications that can target that pathway. But overactivation of that pathway leads to loss of control over cell growth and cell division, which is why we see many of the manifestations of that patients have with tuberous sclerosis complex, which is development of what we call non-malignant or benign growths, often termed tubers in the brain. But this can occur in the skin, the eyes, the kidneys, the heart, the lungs, the liver. So it's grossly manifested throughout the body. Now, things to look for as a clinician are actually quite evident in tuberous sclerosis complex because it's also known as a neurocutaneous syndrome. So you have neurologic syndromes, but you have cutaneous or skin findings. So often things that you can see secondary to this overactivation and this overgrowth. So things that you can see on these patients are hypomelanotic macules. So these are light patched macules throughout the body. You can also see angiofibromas on the face, over generally in this distribution. You can also see something called a shagreen patch as well. And I really encourage clinicians to look up some of these things because there's a vast amount of information and photos of this to help identify these on individuals with tuberous sclerosis complex. But even what's more important with TSC is because of these growths, we can identify this disorder at a very young age, even in utero. So with fetal ultrasounds or regular ultrasounds, you can identify the cardiac rhabdomyomas or the growths in the heart. And if there's concern for that, you can then do a fetal MRI to see these growths in the brain as well. And some of these growths in the brain are called cortical tubers or subependymal nodules, or giant cell astrocytomas, and those are growths in the brain which lead to what we
Applications in medicine. It's a very important disease because it causes skin abnormalities. It can often affect the brain, causing seizures, behavioral problems such as hyperactivity and aggression and intellectual disabilities. Also kidney tumors, and since it affects 1 in 6,000 people, it's rare and important to be able to diagnose it. Tuberous sclerosis can be the result of either a random cell division error. About 2/3 of people who have tuberous sclerosis have a new mutation in either the TSC1 or TSC2 gene and do not have a family history of tuberous sclerosis. Inheritance. About 1/3 of people who have tuberous sclerosis inherit an altered TSC1 or TSC2 gene from a parent who has the disorder.
One of the presentations I was most excited about at the AAN was the open label extension from the GW trial in tuberous sclerosis complex. Taking care of patients with tuberous sclerosis has been a focus of the majority of my career. And we know that 2/3 of patients with tuberous sclerosis develop highly refractory epilepsy, so much higher than in the general epilepsy population. What we saw in the randomized control portion of the trial is that similar to LGS and Dravet, CBD appears to be effective for many people with refractory seizures in TSC. What we learned from the open label extension is similar to the LGS trial and Dravet trial, is the efficacy is maintained and the tolerability is good. The difference between the TS trial and the LGS and Dravet trials is that the doses of CBD were higher, as opposed to 10 and 20 milligrams per kilogram per day. In the TSC trial, it was 25 and 50 milligrams per kilogram per day. So what we learned from the randomized control portion is that efficacy is there. It's not really linear. The efficacy at 50 mg per kg is pretty similar to what we saw in the other trials at 20, 25 mg per kg. But the higher the concentration or a higher dose is also pretty well tolerated. As expected, there were more adverse events, particularly more cases of diarrhea, more fatigue. But I think it's important to know that if patients do need to titrate up to those higher doses, that we know it can still be safe and well tolerated and effective. Another one of the abstracts at the AAN that involved GW CBD trials was an abstract about the tuberous sclerosis CBD trial. And that was a really interesting abstract looking at, in patients in those trials, how soon was efficacy seen. Of interest, because when we start a patient on a medication, it's important to know kind of, will it take weeks to titrate up to a certain level before we see efficacy, or can it be seen earlier? Another reason to look at this is, since the trial did include higher doses of 25 to 50 milligrams per kilogram per day, looking to see how soon we saw efficacy would also let us know, would those patients also possibly respond at a lower dose, like we saw in the LGS and the Dravet trials. And so what was seen in that was efficacy was seen pretty early. Typically efficacy, I think, was seen within the first 2 weeks of the trial, so during the titration as people were working up to their dose. So that was also good. We also learned from that data analysis that the adverse events are also seen kind of relatively early, and many resolve then with course of treatment. So again, letting us know that with our patients, if we do start them on CBD, GW-CBD, that we can let the families know that they won't have to wait months to see efficacy from this drug, which matters. If you're watching your child or if you're having seizures daily, it's good to know it won't take months, hopefully, for a medication to work, but maybe a matter of weeks. And also that if we are going to have tolerability issues, we will see them early. And we're also learning how to really troubleshoot those, so to make sure that our patients tolerate this medication well.
In the case of pros and cons, pros. In 2012, the International Tuberous Sclerosis Consensus Conference reviewed prevalence and specificity of TSC-associated clinical manifestations and updated the TSC diagnostic criteria from 1998. Clinical features of TSC continue to be a principal means of diagnosis, but include additional clarification and simplification. In addition, TSC may now be diagnosed via genetic testing. There are commercial labs in the United States offering TSC genetic testing. If your child has had seizures, diagnostic testing will likely include an electroencephalogram. This test records the electrical activity in the brain and can help pinpoint what's causing your child's seizures. Cons. Most people with tuberous sclerosis have patches of light-colored skin, or they may develop small, harmless areas of thickness, smooth skin, or reddish bumps under or around the nails. Growth in the brain may be associated with seizures, which can be the first symptom of tuberous sclerosis. It can be associated with developmental delays and sometimes intellectual disability or learning disabilities. Common behavioral problems may include hyperactivity, self-injury, or aggression, or issues with social and emotional adjustment. Most people with tuberous sclerosis develop non-cancerous growth on their kidneys, and they may develop more growth as they age. Growth in the heart, if present, are usually largest at birth and shrink as the child gets older. Growths that develop in the lungs may cause coughing or shortness of breath, especially with physical activity or exercise. Growths can appear as white patches on the light sensitivity tissue at the back of the eye.
We have a clinical trial that's starting to enroll in November. It will be at 7 sites around the United States, and it's the first trial to look at the ability to prevent the onset of epilepsy in children with TSC, with tuberous sclerosis complex. So this trial was enabled by a biomarker study that was funded by the NIH that showed that babies who are diagnosed with TSC before the onset of seizures, and this can occur because either they're born to a parent who has TSC, so we know to look for the disease, or because they are found to have cardiac rhabdomyomas, or this tumor in the heart. Even at prenatal ultrasound, it can be detected, and a TSC diagnosis can be suspected. And so then if an infant with TSC is diagnosed within the first few years of life, they can be followed by serial EEG, electroencephalographic recording, over time. And the biomarker study showed that those infants that develop abnormalities in the EEG can predict the predilection to develop seizures. And so a new preventative trial is being started where babies will be followed as soon as they're diagnosed with EEG at regular intervals. If abnormalities in the EEG that are suggestive of potential seizure development in the future are detected, they'll be randomized to placebo or vigabatrin, which is currently approved for the treatment of infantile spasms. And the measurement then will determine whether or not those children go on to develop epilepsy. If they do, is it refractory epilepsy? Or do they have better outcomes in terms of development, in their developmental stages and their cognitive development? And all this will be assayed at 2 and 3 years of age down the road. So about 2/3 of children with TSC will have epilepsy within the first 1 to 2 years of life, but we don't know which ones. So this study, using EEG, which is relatively non-invasive, enables us to test otherwise healthy babies and determine from the outside, from the EEG, whether or not they're at risk of developing seizures. It's not 100% predictive. Some may develop seizures even though their last EEG was clean. But we found that an abnormal EEG is highly predictive that they will go on to develop clinical seizures. So rather than wait and treat the seizures, we'd like to intervene earlier and see if that makes a difference. And we'll learn, in the worst case, we learn that standard of care, and that is that treating with vigabatrin after infantile spasms, if that's the type of seizure they get, the treating with vigabatrin is no better, treating early than late. But we might find out that even that earlier intervention, before those clinical seizures have started, could lead to better outcomes. And that's what we want to find, because if it does, then it could be worth doing. And in those babies who do not develop abnormal EEGs, they'll never be treated. They won't be randomized. They won't be treated with either placebo or drug. They'll simply be followed. And then that will serve as really the control group, if you will, for normal developmental stages with TSC in the absence of epilepsy.
Issue apply in Ecuador. A search of the medical records of patients with tuberous sclerosis was carried out between 2012 and 2016 in a pediatric hospital in Ecuador. 31 patients who met the definitive diagnostic criteria were selected. 22.5% of the patients had a family history of TSC. 61.3% of the patients were diagnosed before 2 years of age. In 74.1% of patients, seizures were the most frequent clinical characteristic at the time of diagnosis. Of this group, 39.1% had refractory epilepsy. This series of patients represents the first Ecuadorian descriptive study of TSC. The most frequent manifestations found are neurological, epilepsy, autism spectrum, and intellectual disability. And finally, we have the conclusion. Tuberous sclerosis, also called tuberous sclerosis complex, is an uncommon genetic disorder that causes non-cancerous tumors to develop in many parts of the body. It is often detected during infancy or childhood. Some people with tuberous sclerosis have such mild signs and symptoms that the condition isn't diagnosed until adulthood, or it goes undiagnosed. Others experience serious disabilities. People with tuberous sclerosis may consider genetic counseling before their reproductive years to understand their risk of passing on the condition and their reproductive options. And that's all. Thank you for watching the video.